U.S. intelligence officials say China has concealed the extent of the coronavirus outbreak by underreporting total confirmed cases and the total number of deaths.
Well, officials also say that China's reported virus data appears to be on the light side. And the White House also saying the U.S. could have been better prepared if China had been more transparent.
Well, and if that isn't enough, according to one network, Beijing is tightening its grip on the study of the origin of the virus and the publication of the coronavirus research.
Well, here to talk about this and more, we bring in former Deputy National Security Advisor to the Vice President, Dick Cheney, and CEO of DC International Advisory, Steve Yates.
He's joined by the Heritage Foundation's fellow at the Institute for National Security and Foreign Affairs, Dean Cheng. Welcome, gentlemen.
Thank you.
All right, guys, I don't know if you can see it, but this is my shocked face. I can't believe that we're even this, it takes U.S. intelligence to figure out that China's not being straight with us. I mean, that to me is the surprise, that we actually think that that they would be truthful with us. They've not been straight with us on a total amount of things over the years, and now we think suddenly they're going to be straight with us. I think this is bigger than that, though. What's surprising to me is this thing's caused by China, it's covered up by China, and now where do we run for help? China. We go back to them for our pharmaceutical goods, for all the things that we need to have made, masks, et cetera, et cetera. We're relying on the people who caused this problem to solve it, and then we're also concerned that they're not being straight with us. I mean, tell me, am I wrong that I feel like these guys have pulled off the perfect scam more than anything else?
Well, I think that, first off, we do need to recognize that at this point, there's not much evidence that this was caused by China, right? It's a disease that emerged from China, but I think it is probably misleading to think that the Chinese somehow created this virus. That being said, there's no question that absolutely the West has decided that somehow China is going to get a pass. We're going to accept their data. We're going to not hold their feet to the fire. We're going to name it differently because we don't want to cause offense. So if I were Beijing, I'd be looking at this and I'd be pretty happy with the outcome of a disease that came out of China that, as you said, the information about which was definitely suppressed and manipulated and has led to global disruptions, generally doesn't seem to have come back to haunt the Chinese leadership.
Steve?
Well, they've definitely chosen censorship and political warfare as their primary tool in response to this outbreak. And there's actually no scientific evidence to suggest that the disease came from anywhere other than China. The fact that they covered up, it didn't just hurt Americans. I mean, it hurt Chinese, it hurt a lot of people around the world. And there's no question that having this false data out of China at the front end led people to make different kinds of governing decisions, and it allowed for a much wider spread of the disease. In fact, they closed down transportation inside of China while allowing international flights for some time afterwards, which seems to be an extremely cynical approach to a pandemic outbreak to allow it to go out internationally. So I think in some ways, I agree with Dean that to date, they've largely been given a pass. But you got to believe the people of Great Britain are pretty fed up with their prime minister having a near-death experience as a result of this, and that everything from 5G to the supply chains for pharmaceutical and medical issues has to be more broadly on the table. And I think it's now more bipartisan than it's ever been.
You know, Dean, you were right when you're saying they've been given a pass. When you're guilty of something, usually you have an alibi to prove that you didn't do it. They're instead saying, we're not going to give you the information. So my question is, what are the next steps to be done for China? Should they be reprimanded? Should they just continue to be given this pass? How are they treated in response to them saying, hey, we're going to pull back information and not be more forthcoming with you? Dean?
Well, let's begin with some basic things, right? I'd love to see the American press not use Chinese talking points as their headlines. When an op-ed in the New York Times is basically how China bought us time, and they hand over, valuable real estate to Ambassador Cui Tiankai of the Chinese, the Chinese ambassador to the U.S. That's allowing the Chinese a soapbox. I'm pretty sure our ambassador to China doesn't get, a full page or so of People's Daily. After that, I think we should be very careful in looking at, for example, future heads of international organizations like the WHO. To what extent might they be influenced by Chinese pressure? Steve brought up 5G. I think the fact that all of us are now working off of broadband for interviews and meetings is going to make 5G incredibly more important after COVID-19. And you know the Chinese are just waiting to roll Huawei back into the fight, saying, hey, you need 5G, we'll deliver that, and we're going to deliver it cheaper. We need to have an answer to that.
Steve, what do you say? What should be done? What are next steps for China?
Well, I think understandably, our leadership and our allies around the world are first and foremost trying to clamp down on the health crisis. But you can see very openly a lot of public policy percolating to the top about steps that will be taken. We've had U.S. senators very early on talk about getting supply chains out of China with regard to pharmaceuticals. There's a lot of talk about how China should need to pay on this. There's talk about pursuing a path other than the World Health Organization, since that organization under the United Nations has absolutely failed the world and failed its funders. You even have the Deputy Prime Minister of Japan, not a nation known for bombast when it comes to public diplomacy, saying that this came out of China and the World Health Organization has essentially become the Chinese health organization. So I think there's a movement out there about steps to take coming out of this, but I don't think we're going to see that first and foremost for another month or two after people have greater confidence that we're out of the woods somewhat on the health side.
And who should be the person to enforce that? Who should be the person to make us take those next steps? Should it be Trump?
Sovereign states. I mean, really, it comes down to sovereign governments acting on their own with each other. The United States, Great Britain, Japan, and other like-minded countries. But Australia has been affected by this in a big way, too. There's lots of countries that have seen the bad side of this. There may be opportunities with countries like India and others to build out capacity. But I think people have seen that the globalist view, this international organization of the United Nations, has failed humanity on security issues like North Korea and Iran, and now this health issue and on security issues. And so I think it's coming down to sovereign states working together with each other. And even with the United States, it's the governors and the sovereign states in the United States that are really the front line in this more than the federal government.
Okay, so here's what I agree with both of you, what you're saying. Here's the thing that I think is interesting, though, and I mentioned it at the outset. Dean, I take your point. I mean, they may not have caused it, it emanated from there, but this is the next disease in a line of diseases and flus and that have come from China, right? And what is our response? Our response is we cover up for them. The media uses their talking points, as you point out. But more and worse than that is then we look to them for the solution. We're getting our pharmaceuticals from China. We're going over there and buying our masks from China. So they have been the ones that allowed this to go on as far as it did. They covered up the fact, and then we turn to them for the solution. The thing that I think is interesting, and you're both bringing it up, is I don't see anyone in this country from a political standpoint saying we've got to stop buying from China. We've got to stop trusting China. In fact, we're going on with business as usual. We're writing op-eds, but I think you're absolutely right. Why are we not raising Huawei right now? Why are we not saying, hey, this is Lucy with a football. How many times is it going to get pulled out from under us before we realize that these guys are screwing us? And I don't see any of the political leadership in this country saying we've got to stop. I mean, Dean, am I wrong?
You're not wrong, Sean, but I think that we have to face a certain reality here, which is also, imagine you moved ibuprofen factory back to the United States. First off, how long is it going to take to open that plant? Okay. I mean, we already hear, how dare we, loosen any environmental regulations? How dare you even think about having FDA do anything other than double-blind extended trials, even for medicines? So by the time you open an ibuprofen factory back in the U.S., hopefully the crisis is past, in which case the products out of that factory are going to be outpriced by the stuff coming out of China. Are you going to subsidize this plant for all eternity? Are you going to basically, impose tariffs to try and get, this is the problem here is these companies and these factories didn't move to China because, capitalists are greedily, rubbing their hands. They did it because it made sense to move low value commodities production to China. How do you counter that? That's a good question. The hope there, in my book, is that places like Peru and Indonesia will be more attractive alternatives.
Right.